Hello friends, the topic of this video is hip joint. This is one of the most important topics of lower limb and often a long question is asked on hip joint. And if it is asked, you are supposed to write your answer under the following headings. That is, first, describe the type and subtype of the joint, then the articular surfaces, then capsule and the ligaments, and then after that movements and the muscles which are responsible for producing them, and also relevant applied aspect. Let's begin with the type of hip joint. You can see in this picture, the circle is encircling the hip joint and this is present between the hip bone and the femur. The type of joint is synovial and the subtype is ball and socket. We'll just see which structure forms the ball and which structure forms the socket here. But before that, let us see here, the hip joint is designed for stability and weight bearing at the expense of mobility. So mobility is slightly restricted here, but it is a very stable joint here. Unlike shoulder joint where the mobility is more and the stability is compromised. Now let us look at the articular surfaces of this joint here. So we see here the articular surfaces. First is the head of the femur. So you can see here, this is the head of the femur, and during lifetime it is covered by hyaline cartilage or articular cartilage, and this forms the ball of the ball and socket joint. The other articular surface is the acetabulum. You cannot see the cavity here, you can only see the margins of the acetabulum, right? So this is going to form the socket into which the head of the femur is going to fit into. So the articular surfaces are head of the femur and the acetabulum. Let us look at some of the details of the articular surfaces. So here we can see this is the upper end of the femur and this is the head of the femur. This light blue colored structure which you see here, so this is the articular cartilage, which is hyaline type of cartilage, and it covers the head of the femur. This head of the femur, you can see the shape of this, it is almost spherical. It forms almost 2/3 of a sphere here. Now this articular cartilage covers the whole of the articular surface except for a point here, a depressed area here which is known as fovea capitis. And we have a ligament attached here, and that ligament is ligament of head of femur. The other articular surface is the acetabulum. So here we can see this is the hip bone and this is the acetabulum here, and this is the acetabular cavity here. Now here also you can see the articular cartilage, right, which is covering the depressed area of the acetabulum, and in the center we have a slight area which is not covered by the hyaline cartilage or the articular cartilage. In fact, fat is present here and this is known as articular fossa. So this area which is you can see here, which is covered by articular cartilage, that is going to come in contact with the femoral head. Now the margins of the acetabulum, there we have a wedge-shaped fibrocartilaginous structure attached which is known as acetabular labrum. So this is a fibrocartilaginous wedge-shaped structure here. When we look at the margins of the acetabulum, we find inferiorly there is a gap between the two ends. And this gap is known as acetabular notch. And this acetabular notch is bridged by a ligament which is known as transverse acetabular ligament. We can also see here the attachment of the other end of ligament of head of femur that can be seen here. As I said earlier, the hip joint is very stable. So how it is made stable? First is the head of the femur fits accurately into the acetabulum. The acetabulum is quite deep and it is further deepened by the presence of acetabular labrum. Then we have very strong 3 ligaments which support the capsule from the outer side or outer surface, on its outer surface. We also have some small surrounding strong muscles which will also provide stability to the hip joint. Besides that, the atmospheric pressure also helps in maintaining the stability of the joint. Let us now consider the fibrous capsule. It is very strong and it tightens in full extension of hip joint. In this picture, we can see this is the interior aspect of the fibrous capsule surrounding the hip joint, and this is the posterior view of the fibrous capsule here. Right, now let us look at the attachments of the fibrous capsule. First we will consider the medial attachment. So medial attachment will be obviously on the hip bone, and it will be attached along the margins of the acetabulum, which can be seen here in both the views, anterior as well posterior, also to the outer surface of the acetabular labrum and to the transverse acetabular ligament, which we saw a little before this. So it will be attached also to the transverse acetabular ligament, which bridges the gap between the lower ends of the margins of acetabulum. Now lateral attachment, let us look at the lateral attachment. Laterally it will be attached here onto the femur. So this is the anterior side. So here we can see this is greater trochanter, this is lesser trochanter, right? And between them there is a intertrochanteric line. So anteriorly the fibrous capsule will be attached to the intertrochanteric line, but posteriorly if you see here, so here we can see this is greater trochanter, this is lesser trochanter, and here we have the intertrochanteric crest, but it is not attached to intertrochanteric crest. It is in fact attached 1 centimeter medial to the intertrochanteric crest. So anteriorly the whole of the neck of the femur is intracapsular, whereas posteriorly part of the neck of the femur is outside the capsule. In this diagrammatic sketch, you can also see now the attachment of the fibrous capsule. This is anterior view, this is posterior view. So medially you can see attached along the margins of the acetabulum to the outer surface of acetabular labrum and to the transverse acetabular ligament. That is what we can see here also, right? Now, if we look at the attachment of the capsule on the femur, anteriorly it is attached along the intertrochanteric line, but posteriorly it is attached 1 centimeter medial to the intertrochanteric crest. Coming to ligaments, we have 3 very strong ligaments which will be supporting the capsule from the outside and 2 more ligaments. So in total there are 5 ligaments. Let us look at the first ligament, that is iliofemoral ligament, which we can see here red in color. The shape of this is inverted Y shaped. So it is inverted Y shape. This is one of the strongest ligaments of our body, and it is the thickest of the 3 ligaments which support the fibrous capsule from outside. Now it is attached here you can see on the hip bone to the anterior inferior iliac spine. So this is anterior inferior iliac spine, and on the femur it is attached to the intertrochanteric line. Now as this is Y shaped, you can see here, so it has got 2 limbs, medial. This is the medial one, sorry, and this is the lateral one, right? They are the strong bands. So it has got medial and lateral strong bands, and the intermediate area is very thin, right? Now, this ligament prevents hyperextension of hip joint. There is a tendency for us to fall backwards at the hip joint because the center of the gravity that passes behind the hip joint. So there is a tendency of hyperextension. This is prevented by iliofemoral ligament, and that's why this has to be one of the strongest ligament of our body. The second ligament is the pubofemoral ligament. You can see here the green in color, which you can see here. So this is triangular in shape. You cannot see the whole of this because it will be passing deep to the medial band of the iliofemoral ligament also. So this is pubofemoral ligament. It is triangular in shape. It is attached mainly here to the iliopubic eminence, also to part of superior ramus of pubis, obturator, crest, and as it goes towards the femur, it blends with the capsule and also with the medial band of the iliofemoral ligament, on the deeper aspect of medial band of iliofemoral ligament. Now this supports the inferomedial part of the joint, and it prevents hyperabduction. Third ligament is ischiofemoral ligament. So as the name suggests, this will be coming from the ischial part of the hip bone. So we have 3 parts of the hip bone: ilia, pubis and ischium, and from each part we have a ligament which is going to the femur and supporting the fibrous capsule from outside. So here you can see this is the posterior view of the hip joint, and this yellow colored ligament is the ischiofemoral ligament here. Now it is attached on the hip bone beyond the margins of the acetabulum. On the posterior aspect you can see that, and the fibers, they actually spiral superolaterally and merge with the capsule on the posterior aspect of hip joint. This ligament reinforces the posterior aspect of the fibrous capsule and it limits the medial rotation of the hip joint. We saw that the iliofemoral ligament that prevents hyperextension of the hip joint. The pubofemoral ligament that limits abduction of the hip joint, and the ischiofemoral ligament that limits the medial rotation of hip joint. The fourth ligament is round ligament of head of femur. We have already seen this ligament. Now this ligament is not present outside the fibrous capsule. In fact, it is present inside the joint. So we can see this small ligament here. This is the round ligament of head of femur. Now it extends from the head of the femur. There is a depression here known as fovea centralis. From there to the acetabular notch and to the transverse acetabular ligament. This carries blood vessels to the head of femur, mainly an acetabular branch from the obturator artery that will reach the head of the femur from here. The fifth ligament now, that is transverse acetabular ligament. This also we have considered. Now this is attached to the two ends of the acetabular notch. Remember the acetabular margin that has a gap on the inferior aspect, and this transverse acetabular ligament that actually bridges the gap between the two ends of the margins of acetabulum. So these are the 5 ligaments. 3 outside, that is the iliofemoral, pubofemoral, ischiofemoral, 1 inside, that is round ligament of head of femur, and the other one which supports from the inferior aspect and completes the acetabulum here and bridges the gap between the acetabular notch, that is transverse acetabular ligament. We will now look at the movements at the hip joint. So the movements possible at hip joint, they include flexion, extension, adduction, abduction, medial rotation and lateral rotation. We will begin with flexion at the hip joint. So in this picture you can see here the flexion at the hip joint. The thigh is taken forwards. So the muscles that will be responsible for flexion, it is very easy to understand. They have to be present anterior to the hip joint. So that's what we can see here. This is the anterior compartment of the thigh, and the muscles responsible for flexion, they will we'll start from the lateral side here. This is iliacus. Then we have psoas major, then pectineus, and then we have the sartorius, which is also crossing the hip joint on the anterior aspect. And finally we have here the rectus femoris, right? So these are the 5 muscles which will be responsible for flexion at hip joint. Next movement is extension, and we can see here in the extension we can see the thigh is taken backwards. So here the muscles that will be responsible for extension, they have to cross the hip joint posteriorly. So again we have 5 muscles responsible for extension at the hip joint. First is gluteus maximus. So you can see here this is the gluteus maximus muscle. This is a very powerful extensor of hip joint. This is not used normally during walking, but for powerful extension movements it is used, such as jumping or running. The other muscles which help us during normal walking, right, in extension at the hip joint, they are the hamstring muscles present in the posterior compartment of the thigh. And they are, we can see here, this is semitendinosus, and here we can see on the lateral side, this is the biceps femoris, only the long head, because only that crosses the hip joint. It takes origin from ischial tuberosity. The short head will take origin from femur, so that doesn't cross the hip joint. So only long head of biceps femoris. Then deep to the semitendinosus, we can see a part of this muscle, that is semimembranosus. So, and we have the adductor magnus. Which part? The ischial head only, right? The other part that will be involved in adduction. Only ischial head will be involved in extension at the hip joint. All these muscles, they will be taking origin from the ischial tuberosity side, inserted onto the femur from the pubic bone. So they will bring the femur towards the medial aspect. So they are responsible for adduction. abduction of the hip joint. In this moment, you can see here the lower limb is taken away from the median plane. The muscles responsible for this are the gluteus medius minimus and the tensor fascia lata. You can now appreciate here these muscles are present on the lateral aspect of the hip joint. We can see here the gluteus medius and minimus taking origin from the gluteal surface of the ilium and reaching the greater trochanter, which is present on the lateral aspect of the femur. And we can also see here the tensor fascia lata. One more muscle which is going to help in this is the sartorius. That also helps in abduction. Medial rotation of the thigh or medial rotation at the hip joint. So you can see here the movement of the thigh, the femur is going to rotate medially in this direction. The muscles which are responsible for medial rotation, it is very simple to remember. We have just done the muscles responsible for abduction, right? So you include those three muscles, that is gluteus medius, gluteus minimus and tensor fascia lata, plus the adductor muscles also. Right? The only muscle which is used in abduction at hip joint but not in medial rotation is the sartorius. But otherwise, these three main muscles, gluteus medius, minimus, tensor fascia lata, they are same which are used in abduction at the hip joint. Plus, you will also remember this is medial rotation, right? So on the medial side, which muscle are present in the medial compartment of the thigh? The adductor muscle. So include them also. Lateral rotation at the hip joint, we can see here the femur will be rotating laterally in this direction. Now the muscles which will be responsible for lateral rotation, they will be present on the posterior aspect of the hip joint, and for rotations always short muscles are used, right? For flexion, extension, longer muscles are used. For rotation, the origin insertion of these muscles has to be close to the joint. So lateral rotation, let us look at the muscles that will be responsible. The piriformis, which you can see here. Then we have the obturator internus with the two gemelli, that is superior gemellus and the inferior gemellus. We have quadratus femoris here and the obturator externus. So this is simple to remember, all those muscles which will be short muscles and will be present on the posterior aspect of the hip joint. So again I'll repeat, piriformis, then we have obturator internus with the superior and inferior gemelli, quadratus femoris and obturator internus. These are the muscles responsible for lateral rotation along with sartorius. So sartorius is the muscle which actually helps in three movements, that is flexion at the hip joint, abduction at the hip joint and lateral rotation at the hip joint. Coming to relations of the hip joint. Now this is a sagittal section from the hip joint. You can see here the acetabular cavity can be seen here, the transverse acetabular ligament and the ligament of the head of the femur can be seen here. Now let us look at this direction, right? It is showing. So here we have, this is the superior aspect, this is inferior, this is anterior aspect and this is the posterior aspect. So let us look at the relations. It is very simple to remember. Anterior, you have to remember the muscles and the blood vessels which will be present anterior to the hip joint in the extensor compartment or anterior compartment of the thigh. The posterior, that is simple to remember, the muscles which will be present in the gluteal region there, right, posterior to the hip joint. And let us see the superior, which covers or the superior aspect of the hip joint and those present on the inferior aspect of the hip joint. So let us start with the anterior relations of the hip joint. So what we can see here, we can see here a part of the pectineus here, right, very small part of the pectineus, and then the main muscles which will be present anteriorly, they are the psoas major and the iliacus, iliopsoas, right? So this lateral will be the iliacus and medial will be the psoas major part of pectineus. You can imagine in front of the hip joint on the anterior compartment, upper part, right? Remember the femoral triangle there, and these muscles will be separating the hip joint from the femoral vessels and the femoral nerve, right? Now a part of the rectus femoris, that is the straight head of the rectus femoris, which takes origin from anterior inferior iliac spine, that also will be anterior relation. So it is easy to remember. We'll remember the four muscles here, and they are the pectineus, psoas major, iliacus and the straight head of rectus femoris. And which vessels will be present anterior to the muscles, iliopsoas muscle and pectineus? These are the femoral vessels and the femoral nerve. Now let us look at the superior relations of this, right? So here again we have this rectus femoris, but which part now? The reflected part, which takes origin from the bone just above the acetabular margin, right? So that is the reflected head that will come in relation here. Then we have here this muscle, that is gluteus minimus and gluteus medius, right? So these muscles will be present superior aspect. Coming to the posterior aspect, let us see here. On the posterior aspect, we will have part of the quadratus femoris, a part of obturator externus, right? So this part of obturator externus, and then we have the quadratus femoris, then we have the piriformis muscle, right? And we can see here, this is the tendon of obturator internus with the two gemelli. Remember the muscles which were responsible for the lateral rotation present on the posterior aspect? So that is same here. So we'll start from here. So first is piriformis, then is obturator internus with the two gemelli, part of obturator externus and quadratus femoris. And the nerve, this is the most important relation which will come in posterior relation to the hip joint, is the sciatic nerve. So this is the sciatic nerve. Now all these structures, they are covered by a huge muscle which will be forming posterior relation of the hip joint, and that is gluteus maximus. So posterior relations are clear. Coming to inferior relations, if we see here, part of the pectineus will come, obturator externus, right? That will be coming, and still outside that we will have the adductor group of muscles, and we will also have the hamstring muscles, right? So they are little away from the hip joint, but immediate inferior relations will be pectineus will be there, obturator externus will be there, part of quadratus femoris will be there. Outside that we will have the adductor group of muscles which will be present more anteriorly, and the hamstring muscles which will be present more posteriorly, and the nerve that you see here, which is not in very close relation to the hip joint, but this nerve is the obturator nerve. So these are the relations of hip joint. Nerve supply of hip joint. The nerves which cross the hip joint, they will obviously supply this. So we have four such nerves: femoral nerve via the nerve 2, rectus femoris, anterior division of obturator nerve, superior gluteal nerve, and nerve 2, quadratus femoris. Now these two nerves, that is femoral nerve and the obturator nerve, they also supply knee joint. So that's why if there is any disease, right, or hip joint is involved in any disease process, and there is a pain in the hip joint, that is also referred to the knee joint, and vice versa is also true. That is, pain from the knee joint is also reflected to the hip joint, because both the joints are supplied by branches of femoral nerve and obturator nerve. In applied aspect, we will cover dislocation of hip joint, that is of two types: acquired dislocation of hip joint, which occurs in adults, and another is congenital dislocation of hip joint, which is present at the time of birth. So in case of acquired dislocation of the hip joint, usually it is in the posterior aspect. So 90% of the cases there is posterior dislocation, and this usually occurs such as in car accidents, right? Sudden brake is applied here, and you can see here the knee is going to hit the dashboard, and because of that, then what happens is that the femoral head, right, here also you can see that will be forced or pushed posteriorly. It is going to tear through the inferior and posterior part of the joint capsule, where actually it is weakest also, right? And it may break the acetabulum on the posterior aspect or may not break, but you can see here this will be the position of the head of the femur. Now because of posterior dislocation, the nerve which may get injured is the sciatic nerve, because it lies posterior to the hip joint, and this is at the risk of injury, and this occurs usually in 10 to 20% of cases of posterior dislocation of hip joint. The affected limb obviously will become shortened, and it will be also medially rotated. Congenital hip dislocation, this occurs as a result of developmental dysplasia of the hip, right? The hip bone has not developed properly. So mainly here in this case, what will happen? The acetabulum is shallow, right? Because the hip bone has not developed properly. So this part also doesn't develop properly, and the acetabulum, that remains shallow. So that's why there is a dislocation of the hip joint here. So here the clinical features, they will include limited abduction at the hip joint, and the affected limb will be obviously shorter. So that's all for this video. Thanks for watching, and if you have not subscribed, please subscribe my channel so that I can put more such videos. And if you want the questions and answers in anatomy, all types of that, then visit the website, that is anatomyqa.com. Thanks once again.